is Alexander Alscher. I'm the founder of Samedi. We're quite veterans there for almost 15 years in the digital health. And the topic for today is like how the evolution will go on into wearables. And for that, maybe a first question. Who of you has booked an online doctor appointment? I would expect that everybody raises their hands, but still we're after Corona and we also have to take care of digitalization. Who of you has like a smartwatch or some kind of wearable like a iWatch? So around about a third, okay. That's good because that will be the basics for today. So how AI and smart wearables will shape the patient journey. But nevertheless, we have to see and consider where we are coming from. And we're coming in the healthcare sector from an area which is quite behind in certain digital standards. So this is where I also want to take you on the journey from where we are or the past, if I call it digitization, to digitalization. The first steps of patient portals, what we are doing since 15 years. And then on the first projects we are on to digital transformation. So also seeing and creating new business models, new revenue streams with clinics, hospitals, but also with doctors. And so for Samedi, I said 15 years almost in the market, like over 8,000 customers. We have also the large university clinics as hospital. I will also later come to projects with Charité and other players, and over 30 million patients which you manage on our platform. And there we also publish a book to report, because much in healthcare is also like spreading the word and taking the fear and the respect of digital projects, and that is also one of our missions. I mean, the like other speakers mentioned, it's really still a bad thing. I mean, if you go in the hospitals, you have to fill out sometimes the same form, the same anamnesis files on a paperwork. It's much administrative overhead, and also very many people are in there. And if we look at other fields, we have here 3D printing, even cars or houses, I mean, it's really in such a speed going on, and still we're there and filling out papers. And I mean, this is what we have seen overall, the automation and digitalization in the first sector. I mean, if you look how many people had worked before then, how less people are now there, then the industrial automation. Now we're coming to the intelligent automation in the whole service industry, which is, of course, health is a big part of it. And still we see, lots of burnouts at the doctor side. We're seeing the whole care workers who are stressed out. We have now also after Corona, not so bad as maybe the gastronomy and hotel sector, but still we see also a severe lack of those workers, assistants in the healthcare sector. And of course, there we see a big chance also to help. And for this, I really like the framework from MIT Sloan School. We said there are three phases. The first one is a digitization. So just bring the paper into a digital way and in some kind of software. That helps, of course, a lot if you think about finding information, about avoiding mistakes in terms of typewriting or other things. But this is just the basis. And we're still especially in the hospital, and Dr. Phil's still there to help out there. And then comes the second way in order to also improve the processes to bring parties closer together. So I ask about online appointment booking. So everything which can be done in 24/7, not only when the practice is open, but to be there at any time, new service aspects. And we will also see how appointment will also affect other things in terms of anamnesis, in terms of a video consultation directly speaking to doctors, or also automating the resource planning based on special medical information. But that's not it. I mean, that's it where we are like fighting for the last 15 years. The next step is digital transformation. Now we see like the first step there, that we say, is it the way how we perceive hospitals practices right now? Will it be the way also in the future? Will there be like new business models? I mean, starting off video consultation, starting off analyzing the data, starting off remote monitoring and care patients. And this is something where really the whole system will be shaken up. And we've seen it, of course, in other industries where we like have seen like other companies disappearing. And for the healthcare sector, we see it like also in the first one. It's the MRAM study, which comes from United States, from the HIMSS. It's like a model where they evaluate the hospitals in terms of their digitization. So remember, it's a first step of like bringing analog information in the digital world. Then we have now with the KZG, the Hospital Future Act in Germany, the second step, that they want to have like services for patients in the hospital sector. And then we really, and this is where I want to lead today, also to some kind of a new ways of offering service in terms of a patient portal 2.0, where doesn't play a role where the hospital is. I mean, there's also the aim of St. Hopkins Hospital in the United States to serve more than 1 million patients. And how should you do it with like a normal hospital, only with like digital means where you can offer services? And this is where the road goes. And for this, I really want to take you on the journey, because of course you need to start in the first steps to in the end also arrive at the last step, the digital transformation. So, I mean, in first bringing the hospitals online, this is the MRAM model. You see from 0 to 7. 0 is no digitization, 7 is full. And this is something where it really helped to also measure actually how's the landscape and how is it in terms of also patient safety, satisfaction, and the securing data. And now you see here, we're still in Germany really behind. I mean, of course, it had been improved a bit, but still very behind the other countries, especially Denmark, one of the, I think, best digitized countries, and the United States really at the last part. But we strongly believe now with the KZG, hopefully that will change. Though I'm not quite such optimistic, as I've been also spent last research sabbatical in the United States, and there we have seen Obama did it more than 10 years ago with the Affordable Care Act. So he also put in place several billions to digitize the hospitals, and now you enter a hospital and they have a nice patient portal, but you still enter and fill out a paper. So one thing is, I have a patient portal, or do I really use it and also optimize my process with it? And I hope we can really change it and make it better than in the United States, that we also will have the processes digitalized and not only just marked it as done as required by law. So it's there. I mean, you see Germany in black. It's almost 0. It's remote. It's planning. It's automized check-in. No online functions. So at the level 2, we really have a big backlog and still many things to do. We have also now the first anamnesis. The HIMSS also got the office managed by the government to make the evaluation with also University of St. Gallen, and with the digital radar they also made the first first report. They say 33 of 100 points. Best one with Vivantes, who uses also our eHealth software, but there's still many things to do. And this is what we do. Remember, we're still like in the second phase of digitalization, which is the basis later on for like the wearable connection and artificial intelligence. So what we do there is the online appointment booking, the reminders, confirmation, delay notifications, up to the like resource planning, the referral to the other doctors, and video consultation. So this is like the step 2, and of course with our USPs, data security, we've got patents, interfaces, and process excellence. But we need this still to get in the game, also with like the online connection to the patient, and of course now it's still like the user interface. So the patient has to enter like data, has to like select what he needs, and then will be brought to the right treatment and to the right doctor. We also made it very analytical. So we set up a guideline of like 20 steps where digital from like really starting, I have the need, I like search for a special provider treatment, to the appointment, payment, the confirmation, update, the admission, like appointment chains, to the treatment, and later on to the referral, can be digitized and can be brought online. And there's of course a lot of like efficiency gains and release for the medical network. Just to see it also for the KZG, it's there where we are like in like several areas to support them, and not only the KZG, but also, I mean, we have seen that the last 2 years with the digital vaccination management, we also had to do a lot to bring the people in, all people in. We won the tender for federal state Saarland, where we brought it in, and we made it the most successful federal state in Germany with the highest vaccination rate. We got also last year therefore the medical record, and this is also still the digitalization. So it's not about like bringing into the next level, but still making it faster, making it easier, and in this case also protecting the country and getting back to full track. Now let's get to the next station of where we're gonna end and where we want to lead our customers, hospitals and doctors, also to protect them somehow and not to lose the battle in the end to Google, Amazon, Facebook, or Microsoft, because this will be the competitor in future in terms of who's going to taking care of the patients. And I mean, we see it in other industries, or maybe the term Industry 4.0 about like 3D printing, which I mentioned, smart sensors, which we also see in the hospitals, machine learning, which we also like my former speakers talked about, augmented reality, robotics, cloud computing, and this is of course something which comes from human-centric to machine-centric, also in terms of like predictive maintenance, could be also predictive health, which we can do as Samedi in terms of predictive appointments. So when we have the data to book it, and maybe you think that's too far away, but you have to really see it in a really interesting way. And Professor Wirtz from Austria made an interesting matrix about it. He said we have to maybe differentiate between person and objects and between intangible and tangible action. So it's not the way that we will see tomorrow like robots through the hospitals. That's definitely not. But it will be like the area on the bottom right that we will have recipients of service objects, like we had the invoice just mentioned, and intangible action. And in this area, there will be much happening and many innovations. And so we also did with Samedi. I'm also going to like the concept from Porter, smart connected products in the healthcare sector. He starts from monitoring the patient to control to optimization, and in the end to automate don't have to be a drone, can be also like a software service. And this is also what we as Samedi did. We started with control. So appointment is not just a date and time. We're thinking about the process in the hospital. So what's a doctor? Is there a room? Is there some special emergency room needed? Is a bed or a device needed for this? So this is something which we have to plan for, and this is where we started in 2008. Then we started to think about automation, and we started also with a booking API where we connected to other platforms like Yameda, TK, or Stiftung Gesundheit. So if there like a doctor is shown up, then the request goes from our booking API directly to our service. They send back when the doctor is available for which kind of treatment, and they can be booked directly without being there like a broker or a moderator or even a human between that. For the hospitals, we put a HL7 gateway, so of course that we can block appointments if they are booked inside. And now the last years we've been active in the monitoring in terms of quite easy video consultation, which is now more or less OTC, very many providers. We handled patient forms, so especially for mental health, where they can enter data, and based on this data, not only a human but also like a software can directly book appointments. And we started last year and had this year the first pilot of our wearable connection. And also in terms of optimization, we also founded last year our first analytics team, data scientists. Our first product was a benchmarking where our customers can now see where they are in comparison to other hospitals or to our practices, how many how much idle time, how many appointments, other things they have. So this is according to the line, and this is also where we see the next business models, starting with video consultation. As said, I mean, it's not only the point that I have to be like in Berlin and only like offering my service to the Berlin surrounding, but now I have a certain specialist, maybe in oncology or in dermatologist, and now can also serve someone in Bavaria or someone in Freiburg. And this is something where we also offer the platform to do it. And I just asked it. We had here in the room 1/3 with a smartwatch, and it's really growing, the connected wearables, and we see really many new sensors coming which detect medical data, and so this can be also used for control, diagnosis, and therapy usage. And my vision, I already had it even 5 years ago, that I said, why do a patient need to type in for booking an appointment? Why can't we automate it? Because we have already the technology, and based on if it's even in the smartwatch from Apple has pulse oximetry, so the oxygen level, especially in the Corona times, it was one of the critical factors to see if there's a really problem. Why can't we book it automatically given the medical data which we have? And this is something where we are working on to say, okay, it's not anyone booking there. It's based on the wearable, based on the device, automatic booking. And booking, as said, it's not just time and date. It's just how we plan the operation. When does a doctor has to come? When does a nurse have to come? Which room do we have to take into consideration, and which device? And not only in a single practice, but in a network. So on our platform, we can also, I say, it's like a Lego system. We need an oncologist, we need an internist, we need maybe a surgeon, and to bring them together. For instance, also Asklepios, the oncology conferences are on our platform. And I think this will be the future, especially for these special care fields. And so we have the first projects with also partners who deliver these sensors. We are not doing these sensors, and they use our booking APIs to directly manage the doctor visits on our platform. And so we really see a big new venue for opportunities for hospitals, but also for pharma companies, for laboratories, for further providers in the end, that the patient can benefit from us. And so this is one of the first very simple things. This is even a practice. They have more locations, and they have some kind of a query area. We have like a logic behind it, and based on the things they gave in the direct appointment will be saying. I wouldn't say it's AI. It's more or less a smart algorithm behind it, how they allocate the appointment. But you see, it's like many logics behind it, how to bring the patient to the right statement. The same we did with the Charité, we built the telemedicine portal for the Charité. So based on anamnesis and the prioritization of the patients, the appointments were coordinated, and then also different treatment offers were presented to the patient based on the anamnesis. So was it something which could be scheduled in 1 month? Was it a more urgent thing? Was it a thing where they were like inscribed into a group therapy, or where they get an app also accompanied in their therapy, and was also based in the mental health with a PHQ-9 survey. Then there was a result. For example, you see a depression, also a thing which we've seen especially in Corona times, and then also the location, and then you got the appointment. So with Charité, we built it, and this was only one example. They have much more on it, apart from online booking and video consultation, also expert opinion. They now built, we also did it pro bono for the Ukraine crisis, that they have a portal for the Ukraine refugees, where we now have also the Ukrainian language as part of our portal. Online admission, teleconsultation, that is where we are supporting them as provider. And another project where we are working on is also to somehow streamline emergencies. We call them like the A emergencies. Of course, I mean, it's immediately, it's then by telephone, but of course the resource planning has to function accordingly. Second one, like the B emergencies, which can be handled within 1, 2 or 3 days. And then we have S emergencies based on sensors, which are alarming, and then also the planning of the medical workflows are set in place. So the models beyond 2024, we see additional income streams in terms of second opinion online therapies. We see a huge efficiency increase for it in terms of less planning time, less telephone calls, and better in-time planning. And finally, also new treatment forms of patient monitoring and patient treatments in terms of supplementary and new forms, not only the DIGA approach which we have, but also other ways where we see it. So finally, we come to the conclusions. What we learned, the basics are there. We have the technology, we have the APIs, we can connect to it. The second learning is really the medical knowledge. So in which time should the trigger set in which time should we book which appointment? And this is something, of course, where we, with our customers, learn also a lot and bring it also to other projects. I said the first patient portals was the Charité or Asklepios we set up, and one is of course process automation. So there are results from projects 6% of less calls. I mean, still, like also with the older ones, there will be still calls, so it's not like 100%, but also like a workload reduction and of course new income streams, revenue growth in terms of that. So in the end, to conclude, our goal, of course, the first thing you can say it's like bringing the data and bringing service together. But in the end, we also try to deliver a better medicine with our customers and also new forms of treatments based on digital transformation. Thank you very much for your time and your attention, and hope to talk to you later about possible new ways. Thank you very much.
Yeah, Alexander, thank you very much.